Assalamu alaikum students. I hope you all are doing well. Do you know what is the strongest and only movable bone of the skull? It's mandible. And today I will explore its anatomy exactly the way it is asked in exam. So first of all, orientation, place it in the way like that it is present in the skull. So now parts of the mandible. First of all, this is body, which is horizontal, then ramus of the mandible, vertical part, and then angle of the mandible, which is the junction between body and ramus. So first of all, body have two surfaces, outer surface and inner surface. So features are, first of all, symphysis menti. It is in the midline, and it is formed during the development when fusion of two bodies of mandible occur. Then the second thing is mental protuberance. In simple words, it is chin. Then third one is mental tubercle. Mental tubercle are present at the corners of the chin. So the next thing is oblique line. Oblique line is basically start from the mental protuberance and it move toward till the anterior border of ramus of the mandible, and it is attached. It is the basically for attachment of depressor anguli oris muscle. So a point this is the foramen here. This is called mental foramen, and this foramen is present just below the second premolar, and it is the passageway for mental nerve and vessels. This is the mental foramen. Mental nerve and vessels pass through it. So now internal surface or inner surface. First of all, mental spines. So these are the two mental spines, which are first pair is superior pair, which is for the attachment of genoglossus muscle, and the second is for the inferior pair for the attachment of genohyoid muscle, and these are also called genial tubercles. And the second thing is mylohyoid line, and mylohyoid line is for the attachment of mylohyoid muscle. Now the third thing is sublingual fossa, which is present just above the mylohyoid line, and it is for the sublingual gland. And the fourth thing is submandibular fossa. Here it is the large fossa, and it is below the mylohyoid line, and it is for the submandibular gland. There is also another fossa is present. This is digastric fossa, and it is for the attachment of anterior belly of digastric muscle. So that's all about the body, and its importance is mental foramen, from where mental nerve and mental vessels are pass. Now talk about the ramus of the mandible. So this is the ramus of mandible. So outer surface is rough for the attachment of masseter muscle. So at the inner surface, first of all, inferior alveolar foramen, or it is called mandibular foramen, from where inferior alveolar nerve and vessels will pass. And then the second one is lingula, and its shape is like a tongue, and it is a bony projection, and it is for the attachment of sphenomandibular ligament. And the next part is, and below the lingula and mandibular foramen there is a groove which is called mylohyoid groove, and it is for the passage of mylohyoid nerve and vessels. So that's about the ramus of mandible. So what is its important? This inferior alveolar foramen, from where inferior alveolar nerve are passed, and these will supply mandibular teeth. Then talk about the processes. First of all, this is the coronoid process. This is thin triangular shape, and this is for the attachment of temporalis muscle. Then this is condylar process, and it have a head and neck. So what is the importance of head? It will form the temporomandibular joint with temporal bone, and at the neck there is a muscle which will attach, known as lateral pterygoid muscle at the inner surface. So, and the third thing is this mandibular notch, and mandibular notch is present between the coronoid and condylar process, and it is passageway for the mesenteric nerve and vessels. So next is angle of mandible, and its importance is at the inner surface of angle of mandible there is a muscle attachment which is medial pterygoid muscle at the pterygoid tuberosity, which is shown over here. So now border of the mandible. First of all, this is alveolar border, which is for the attachment of teeth. These are the dental sockets, and then inferior border, which is the base of mandible. So now muscle attachment. So which are the muscles which are attached on the body of mandible? So first of all, mentalis, then depressor labii inferioris and depressor anguli oris. There is the attachment of buccinator muscle, and superficial most is the attachment of platysma muscle. And then the ramus of the mandible. So outer surface is rough, and there is the attachment of masseter muscle, and at the inner surface there is the attachment of medial pterygoid muscle, and medial pterygoid muscle is also attached to the pterygoid tuberosity at the angle of mandible. So medial pterygoid have 2 points of attachment. First is inner surface of the ramus of mandible and the angle of mandible, where pterygoid tuberosity is present. So at the processes, first of all, coronoid process. At coronoid process, temporalis muscle is attached, and at condylar process, its neck is at its neck lateral pterygoid muscle is attached at the inner side. So if I talk about some clinical, so first of all, mandible fractures. So the common site of the mandible fractures are, first of all, this is the angle of the mandible between body and the ramus, and then condylar region over here, and then body at the level of canine. This is at the level of canine. Sorry, this one. So second clinical is inferior alveolar nerve block over here in the when anesthesia is given, and this is for the numbness, and or you can say to the during the surgery or dental caries. So for the to remove all the sensations from the lower teeth. So this is in the mandibular foramen. This injection is injected, and inferior alveolar nerve block occur, and then anesthesia given at the mental foramen to block the mental nerve, so that it will lose sensation at lower lip, lower jaw, and also the mental process. So that was all about the mandible. So I am going to show you some attachments of the muscles that I told you. First of all, temporalis muscle, it will attach to the coronoid process. So it will attach here, coronoid process at the inner surface like this. Then masseter muscle, this is the ramus, and I told you that masseter muscle will attach at the lateral border or outer surface of the ramus of mandible. So here this is the attachment of masseter muscle. So medial and lateral pterygoid. So first of all, medial pterygoid, it will attach at the ramus at the angle. So and the last one is lateral pterygoid muscle. Lateral pterygoid muscle will attach at the neck of the condylar process at here, inner surface. Sorry, at this neck of the condylar process. You can appreciate it where the temporomandibular joint is formed. This one here. So that was all about the muscles and anatomy of mandible. If you like my video, please like, share and subscribe. Thank you.